Organizational Analysis of the Alexian Brothers Neuroscience Institute by Maria Rusiana. The organizational structure of the Alexian Brothers Neuroscience Institute is a functional structure. In a functional structure, services are arranged according to specialty. The services providing similar functions report to a common manager or executive, which in the case of the Alexian Brothers Neuroscience Institute is a director. Under my organizational chart, the clinical director of the Alexian Brothers Neuroscience Institute heads the Neuroscience Institute, and under her are the different departments, which is the Acute Stroke Care Services, Interventional Neuroradiology, Clinical Research, Epilepsy Center, Health Psychology, Illinois Gamma Knife Center, Illinois MEG Center in Brain Mapping Technology, Memory Disorders Center, Movement Disorders Center, Neuropsychological Services, Neurosurgery, Pediatric Neuropsychological Services, Second Opinion Stroke Clinic, and finally, Vertebral Augmentation for Spinal Compression Fracture. Those are the different departments under the Neuroscience Institute, and each of those departments report to their particular director. The Alexian Brothers mission is: Alexian Brothers Health System carries out the healing mission of the Catholic Church through the Alexian Brothers ministries by identifying and developing effective responses to the health and housing needs of those we are called to serve. The Alexian Brothers vision, this is the mission, and the Alexian Brothers vision is: Alexian Brothers Health System will engage all our associates and partners in a prophetic, holistic approach to healthcare rooted in gospel values and the 800-year legacy of the Alexian Brothers. We seek to bring healing to a broken world through collaboration with others. Okay. In decision making, I believe that Alexian Brothers Neuroscience Institute partakes in a democratic or participative approach, which means management involves the appropriate personnel in the decision-making process according to Yoder and Weiss. Also, they use creativity, which means to conceptualize new and innovative approaches to a problem or issue by being more flexible and independent in their thinking, according to Yoder and Weiss. Also brainstorming, which is an effective method for generating creative options. And finally, they utilize group decision making. The Alexian Brothers mission statement defines the Alexian Brothers Neuroscience Institute's purpose for being and identifies the organization's customers and the types of services offered. So in stating that the Alexian Brothers Health System carries out the healing mission of the Catholic Church through the Alexian Brothers ministries by identifying and developing effective responses to the health and housing needs of those we are called to serve, the Alexian Brothers specified who and what kind of population we are called to serve. Basically, this states that we are called to serve those that are in need. The Alexian Brothers vision statement is a purposeful statement that identifies the desired future of the organization. So in stating, under the vision, that we seek to bring healing to a broken world through collaboration with others, states that As a future goal, Alexian Brothers seeks to heal and aims to better a broken world through collaboration with others. As an organizational structure, Alexian Brothers Neuroscience Institute is a very effective functional organizational structure. A functional structure supports professional expertise and encourages advancement. Here's one example. A stroke nurse navigator works under one department, which is the Acute Stroke Care Services. The role of a stroke nurse navigator is to follow an inpatient while they're admitted in the hospital as with the diagnosis of stroke, and give teaching and help families, friends, family members, and the patient cope with the new diagnosis. And after discharge, the stroke nurse navigator follows eligible patients by giving follow-up phone calls after 3 months, 6 months, and 12 months. As an example of advancement and of professional expertise, if the stroke nurse navigator encounters any dilemma with, for example, the eligibility of a client of whether they can be registered under the stroke nurse navigator program, or how well a patient can learn the difficulties and when to follow up with their doctors and the medications they should take, and how a patient and family copes. The stroke nurse navigator turns to the director of the stroke program, which is the expert in this diagnosis. So the medical director of the Alexian Brothers Health Network Stroke Program is a leader in research for stroke and is a very active resource for the Alexian Brothers Neuroscience Institute. In referring to him, the stroke nurse navigator, which is a registered nurse, will gain expertise by learning and collaborating with the medical director of the stroke program. And in this way, advancement will be encouraged. Now, as far as decision making, in utilizing democratic or participative approach, creativity, brainstorming, and group decision making, I believe that the Neuroscience Institute benefits in the results of critical and collaborative thinking. For example, as an effort to promote community awareness of stroke, especially for the upcoming Stroke Alert Day, the stroke clinical nurse specialist, which also works under the Acute Stroke Care Services Department, collaborated with the clinical director of the Alexian Brothers Neuroscience Institute, with the stroke nurse navigators, and with the student, which is me, to organize a meeting to reach out to stroke directors from competing hospitals in the Chicagoland area to have a meeting to prepare for Stroke Alert Day. So as a result of that meeting and arranging for this Stroke Action Alliance meeting to be possible, as a result of the collaborative efforts, a Stroke Action Alliance meeting was successful with over 24 stroke directors in the Chicagoland area present and several additional stroke directors in the phone conference, all of which participated in the meeting in trying to find creative solutions and creative ideas on how to promote stroke awareness during Stroke Alert Day. So in this sense, I think the Alexian Brothers Neuroscience Institute is very progressive, and in utilizing the different kinds of decision-making skills, gets to benefit from many of the results of the critical thinking that every single employee can contribute to the organization. Thank you very much.